Good morning. Today I am going to show you how to perform an otoscopy. Otoscope is a battery-operated instrument to examine the ear. The ear can also be examined using the head mirror or headlight. But for a beginner, it is easier to use the otoscope rather than using a head mirror. The otoscope normally comes with a few speculums, as you can see, of different sizes. You are going to select the right type of speculum to be used in any patient. Before deciding upon the speculum, you should look at the external artery meatus and see the size of the external artery meatus. You should try to select the biggest speculum possible, but at the same time, it should not cause discomfort or pain to the patient. You should know how to hold an otoscope. You will hold an otoscope like holding a pen with a firm grip. And then you are going to hold it horizontally. Before starting an otoscopy, you should examine the external artery meatus and the pinna first. Good morning.
Good morning.
I am Dr. Ilango. How can I address you?
Sharon.
Sharon, I am going to examine your ear. Is it all right?
Yes.
Okay. The inspection starts with examination of the pinna, inspection of the pinna. Look at the pinna, see the size, shape, and then look at the postauricular region. Look for any scars in the postauricular region. Sometimes the patient might have undergone some surgery before, so it is always important to examine for the scar in the postauricular region. Then see whether there is any presence of sinuses in front of the pinna. Then, before starting the otoscopy, you have to pull the pinna upwards and backwards in a case of adult, and downwards and backwards in a case of child. This is to straighten the external auditory meatus, which is normally curved. Now I'm going to show you how to examine the right ear using the otoscope. For the right ear, you hold the otoscope with the right hand, horizontally like this. If you want to examine the left ear, you can use your left hand to hold the otoscope. Shavin, can you please turn this side, please? Okay. Gently pull the pinna upwards and backwards, and this is to straighten the external artery meatus. Introduce your otoscope and then try to visualize the external auditory meatus. See whether there is any wax, discharge, or any other abnormality. There is no abnormality noted in this patient in the external artery meatus. Now I can see the tympanic membrane. Remember, you may not be able to see the whole of the tympanic membrane at any one point of time. You may have to adjust the position of the otoscope so that you can examine the whole tympanic membrane. So now I can see the tympanic membrane. So try to identify the handle of malleus, lateral process of the malleus, umbo, and then the cone of flight. The part of the tympanic membrane below the malleolar fold is called as pars tensa. There are no abnormality noted, and her tympanic membrane appears normal. Having examined the ear, now I'll show you how to examine the throat. To examine the throat, you need a tongue depressor and torchlight. You can use the wooden spatula also for examination of the throat. This is the wooden spatula which I am going to examine the throat. Shavin, now I am going to examine your throat. Okay? Open your mouth. Initially look at the lips and see whether there is any abnormality of the lips. Now I am going to show you how to examine the buccal cavity. Yeah? Initially, you have to look into the gingivolabial sulcus in the upper part, and then the lower part. Examine the lower part. At the same time, you can see the tooth as well as the gums. Is there any abnormality in the tooth or the gums? Then look for the opening of the parotid duct, which is found opposite to the second upper molar tooth. See whether there is any abnormality of the opening of the parotid duct. The next thing you have to examine the tongue. Can you please keep your tongue outside? Look for the mobility of the tongue. Can you move the tongue up? Look at the anterior 2/3 and then the posterior 1/3 of the tongue. Look at the margins of the tongue. See whether there is any abnormality of the tongue. Now I am going to show you how to examine the hot palate. Now you can see the hot palate. See whether there is any abnormality of the hot palate. Then you can go on to examine the soft palate. You can see the uvula there. This is the uvula. And then laterally you can see the tonsil. See whether there is any congestion over the anterior pillar or the tonsil. Examination of the throat is not complete without examining the floor of the mouth. Shravan, can you please open your mouth and keep your tongue up? Now you can see the frenulum of the tongue. This is the frenulum of the tongue. And then you can see the submandibular duct and the opening of the submandibular duct here. Thank you very much, Sharon. Today I have shown you how to examine the ears and throat. Please remember, when you examine the ear, you have to examine both ears. Do the inspection, examine the external auditory meatus, examine the tympanic membrane, look for the important landmarks on the tympanic membrane, like handle of malleus, lateral pulse of malleus, cone of light. Look at the color of the tympanic membrane. And then see whether there is any abnormality in the external auditory meatus. And then, holding the otoscope, you always hold the otoscope as though you are holding a pen. For the left ear, you hold it with the left hand, and for the right ear, you hold it with the right hand. Examination of the throat, make sure you go in a stepwise fashion, and then examine the lips, tongue, hot palate, buccal cavity, and then the uvula and tonsil. Look for all the abnormalities. Don't forget to examine the floor of the mouth. You need to palpate the floor of the mouth for completion of the examination. Thank you.